My name is Olivia Hightower. I'm a medical oncologist at Memorial. Self-breast exams are a critical part of monitoring and picking up anything abnormal as soon as possible, which really helps our success rate with treatment of breast cancer. Typically, you use your middle 3 fingers and use the pad of the finger or the fingertips. Go in a circular pattern, making sure to examine the nipple and then outward in a circular fashion. You use your opposite hand to examine the opposite breast. You also want to check for any dimpling of the skin where it's not smooth, or if the nipple is retracted or has a discharge from the nipple. Those are some signs that we want to be concerned about and get evaluated. Self-breast checks should be monthly, and certainly if you feel anything, to contact your doctor as soon as possible. Most of the time what patients do feel on a self-breast exam may not be cancerous, so we encourage people not to panic but to let their doctors know so they can have a formal exam and mammogram and ultrasound as needed after that. My name is Dr. Olivia Hightower. We are Memorial.